and welcome to Straight Talk. Thanks for joining us today. I'm Stephanie Domerat. Now, it's been a little over 2 years since Oregon opened its first psilocybin treatment center. It was also the first center in the nation. Now, the FDA has hailed the fungus-derived psychedelic as a breakthrough treatment for depression. But now the industry itself here in Oregon is still struggling to gain momentum. I take a look at why that is and what advocates say can be done.
We have a mental health crisis. Flat out, we have a mental health crisis. And there's something that can help, and we're not using it, no.
In this downtown Portland high-rise lies a dream for a brighter future.
This is where they come in and they check in. Because people who come here for...
Craig Frank co-owns Sacred Mushroom,
transitional reasons.
one of 25 licensed psilocybin treatment centers in Oregon.
To spark creativity if it's not for a transitional reason or...
Since opening his doors last September,
It's going okay. It's going okay. So this is the largest of our single treatment rooms.
the number of people wanting to take that trip isn't quite as he hoped.
And it's a shame because they were taught they shouldn't engage in something that can really help them. A lot of times when people are engaging with psilocybin, they seek out nature.
Frank took his first journey with mushrooms after Oregon voters legalized supervised psilocybin therapy in 2020.
Measure 109 regulates a promising approach for depression and anxiety.
Do you wish that you came across this sooner?
Oh, much sooner. God, yes. I was the guy who, honked the horn when you cut me off. And now I'm just, you do you.
Just getting the bed ready for the clients.
AJ Zimfer was one of the first in 2023 to get licensed as a psilocybin facilitator, leaving her longtime career
ready.
behind.
To be honest, the first 9 months were pretty good, but that was when I was one of the first 100 licensed people.
Now with close to 400 facilitators, the demand for their help isn't keeping up.
That's kind of the problem. The people who are making the money right now in this are the schools. The service centers are not. The licensing fees for them are very high. The facilitators are not, we're breaking even. And most of us are not doing it for the money.
This is the group room. There was enough square footage in here for dosing 8 clients at a time.
For MJ Wilt, breaking even was a high bar.
I just was not making bank. I'm not even breaking even and not even close. Just a small kitchen here.
In April, she shut down her center, Tryptonite Trail,
where the psilocybin was stored. This is the safe cabinet. It's really sad. I had hopes for the space to serve hundreds and hundreds of people. And in the end, it served maybe 25. And then here is the small dosing room.
Wilt worked as a trauma counselor for more than 20 years, but says her journey with psychedelics was so powerful.
It unearths material that you cannot get to in talk therapy. Yeah.
She had to add it to her healing practice.
Offer them a way to get completely to the other side so that trauma is absolutely in the rearview mirror. It doesn't have a way to impact us in daily life.
Wilt Center is one of 6 in the state that have closed in the last 2 years, due in large part, she says, to a battle that began in the 1960s when psychedelics were criminalized.
And what people didn't realize and still don't realize is that these medicines were being used in psychotherapy back then. But the stigma remains as if it were just another drug like cocaine or heroin.
We were first in the nation and to do this work.
Angela Albee leads Oregon psilocybin services under the Oregon Health Authority. She says getting clients is just one challenge facing the industry.
Overall, licensees have experienced banking, insurance, tax filing issues that exist outside of the model, as well as really high rent.
Centers and facilitators are also banned from most advertising, and the cost to patients can be prohibitive, averaging about $2,500 for a 3-part session and rarely covered by insurance.
Breathing this medicine all the way into the very bottoms of your feet.
Albee says one part of the program that is working well, safety. According to the Oregon Health Authority, in the last 2 years, more than 25,000 psilocybin products were sold to clients, and only 13 people needed help from medics. Still, the hesitancy isn't always about physical safety.
But it's also about the relationship you have to wanting to change or wanting to be a catalyst for something that you're trying to work on. And that can be really scary.
Wow, I'm comfortable here,
As for Frank, he hopes people will push past the fear.
These we call the sink in and go to sleep chairs. Depression, loneliness, trauma-related anxieties.
To what could be
They're overcoming us.
on the other side.
And we need it.
Now, before we get into the discussion part of our show, it is important to acknowledge that psilocybin isn't a new medicine. It has been used for thousands of years in indigenous communities around the world, often as a sacred part of healing, ceremony, and connection. But what is new is how this medicine is being integrated now into the Western healthcare model with state-regulated access, licensed providers, and scientific research behind it. So the big question now, what's next? Today, we have two experts in the field joining us to answer that question. Heidi Pendergast is the Oregon Director for the nonprofit Healing Advocacy Fund, and through her work, she helps to increase the safety and accessibility of Oregon state-regulated psilocybin services. Also joining us is Dr. Adi Ray Wilson-Poe, an assistant scientist at Legacy Health's R.S. Dow Neurobiology Labs. She holds a bachelor's in psychology and a PhD in neuroscience. One of her main research interests lies in improving the safety and quality of supervised psilocybin services. Heidi, Adi, thank you so much for joining us today.
Thanks, Stephanie.
It's a really interesting topic, and we could talk about it for a really long time, so I'm excited to get into more detail. First, though, for people who aren't familiar, Adi, I want to start with you. Can you explain the neurological and physical experience of what happens when someone takes psilocybin?
Yes, to some extent we can, and to some extent it is an ineffable experience. It's impossible to put it to words, and that's exactly why, the world is seeing this renewed interest in these chemicals. So there are active ingredients inside of these mushrooms that bind to certain receptors or proteins in our brain. And when that binding occurs, it causes a change in the brain's activity. One of the things that happens is that new connections between neurons or brain cells are formed. So psilocybin and the other active molecules that it breaks down into, they cause new connections in between neurons. And so that we think is part of the reason why it has some therapeutic value in allowing people to see things from a new perspective.
It's truly fascinating. It's really interesting, and it's also just amazing to me that there's still so much we don't know, and so it'll be interesting to see, what comes next. Heidi, we touched on it in this story, but many providers and those who have these licenses talk about the high costs, all the fees. Since the structure of Oregon's system really places the financial burden on providers, that cost then gets passed on to patients. Can you talk to us about why that is and what could help maybe improve that system?
Sure, and I think it's important for people to know that this is a service model, and most facilitators end up spending 15 hours with an individual client, and they're really working with them before, during, and afterwards. So unlike cannabis or other models, this is really a time-intensive model. And the burden is put on service centers who have high licensing fees to help cover the cost of the program. It's also a small business, and starting any small business is incredibly, incredibly difficult. Additionally, it's federally illegal, which means there's an incredibly high tax burden, sometimes up to 70%. They can't deduct normal taxes like other businesses do. So that's a huge, huge area. So a lot of these businesses are just trying to break even. And with that, this is also a new industry. And so clients are just learning about this. People across Oregon are just learning about this. They're starting to talk to their medical professionals and thinking about whether this could be something that would be a good fit for them. I think in terms of offsetting the cost, what we can do in the state of Oregon is really look to back these programs, to bring data and information on the impact of this program to Oregonians, to the legislature, to offer funds to be able to support people who are going through these services and to support the program so that it's not just from licensing fees.
Is it correct right now that basically this has to be self-funded, so taxpayer dollars can't go to supporting this?
That was written in the original measure, and it's common for the state as programs are getting up and and running to supplement that with general fund. But I think moving forward, I believe this program will be a cost savings program to the state, that people who utilize this will see overall health and mental health benefits in the long term that will save the state. And so we really do hope to be able to bring that to the legislature to get them to invest in this program. But right now it is designed so that licensing fees of the participants in the program from the facilitators and service centers and manufacturers cover the cost of the program.
It is important to note too, as we mentioned, there are 3 sessions, so it isn't like one day you go for an hour. Like you said, you're spending 3 days with someone, a provider, a center that you're also paying for. So there's a lot of hands that have touched this to try to help and bring that to the patient. So that is something that I think not everyone is aware of, which is really interesting. But talking about it from the state level legislative session and what we're seeing for changes, House Bill 2387 was just signed into law. I know your group was a big part of that. Talk to me about what changes that will mean for this.
Yeah, we're really excited about this bill. It was informed by the community of psilocybin providers, but also what we heard from healthcare providers outside of the program. And number one is it offers protections for providers to be able to discuss psilocybin services with their patients. So if you have questions about this, go talk to your medical professionals. It's codified in law that there are protections to be able to help discuss this with patients. Another thing it does is it allows people who hold another healthcare license to bring relevant skills to Oregon psilocybin services, specifically in the preparation and the integration periods. So those are the bookends of the session, the before and after. So what this could look like is a licensed therapist can bring their therapy skills in your preparation before receiving psilocybin services and help you in the aftermath of it to kind of discuss and figure out the meaning making that happens afterwards. So we see this as really a continuity of care and being able to create a bridge to the healthcare community that wasn't there before. There's some additional things around safety, psilocin, labeling, and some other things that we changed in the law, but that's really the big part of it, is creating this bridge to the healthcare community.
How big of an impact and how important is it, do you think, that bridge you're speaking of for people who are psilocybin providers or facilitators to work together with mental health counselors or therapists? Like, how important is that connection even after treatment for someone?
Yeah, I think it's really important, especially just to have the option. Not everyone who utilizes psilocybin is doing it with, they don't necessarily have a therapist ahead of time. They may want one afterwards to start processing what they've learned. But we want to make sure that that option is available and open to folks. We have heard a lot about integration afterwards and ongoing integration being really important to kind of taking the lessons or things that were gleaned from the psilocybin session and making changes in your life.
Can you talk about what happens after you have your session? Your brain kind of remains in that neuroplasticity state for a little while. Is it about a month after, or from a scientific perspective? Can you explain that to us?
Yeah, I mean, I wish that we had enough evidence to answer your question definitively, but that's exactly why our project exists, right? So the Open Psychedelic Evaluation Nexus is set up to understand what happens to folks, before they receive services and follow them for at least a year afterward to answer exactly these kinds of questions. So what we do know for sure is that even for folks who come in for one particular purpose, even if it's just out of pure curiosity or exploration, sometimes unexpected things can happen in the session, and then they find themselves needing additional care afterward. And so, relating back to the bill, I think that this is really important because now that at least there is a mechanism by which unexpected things, which, psilocybin and other psychedelics have unexpected effects. Now we have a mechanism by which we can provide better support for people after they have some, potentially big experience.
I want to talk about access as far as affordability. For those people who want to access this and feel like it's out of their budget, what options do they have? Heidi, I'll ask you first.
Sure. There's some groups like the Sri Eckhart Foundation that provides scholarships to clients. Oftentimes, individual service centers or facilitators will give discounted rates, so people can look into that. And on healingadvocacyfund.org, we have a list of service centers on there. Right now, there aren't large national insurance providers that offer this, so we really are quite limited. But that's that hole is being filled by people who really want to get this modality out there, want to serve the community, and by some nonprofits that are also supporting that work.
That's great. Another hesitation we heard from the public is around fear and stigma. We talked about it a little bit in that story. According to the OHA, as we mentioned, more than 26,000 doses now, an updated number, have been administered, but only 13 calls were for emergency services. Adi, you've studied safety around psilocybin extensively. Can you speak to how safe this really is for people?
Absolutely. So, in our research data, which is separate from the OHA's data, there might be some overlap in the people who show up in each of those data sets. But in our study, for sure, we see that there are very few safety events, and even the safety events that we have are quite nuanced. So, for example, we'll have a client who the facilitator reports, all right, we had to call emergency services. This person was transported to the hospital. But in our research, when we are in conversation with that person, they say, oh no, nothing bad happened to me. I had a big reaction and I'm embarrassed about it, but my facilitator acted very professionally and compassionately. So we have that nuance that's coming from the research data that we don't necessarily get in the state data. Nonetheless, the big picture is that few events are happening.
Why do you think people have this fear, or there is that stigma still remaining?
Yeah, that's a great question, because I think one part of it is, we've all grown up in a culture of the drug war, right? No wonder there's so much fear that, surrounds these substances, is that was intentional. So we have a lot of healing and information and education that needs to happen in order to sort of culturally reprogram, well, what's the real story here? And that's exactly why I'm so excited to be able to contribute to this field, is because we have now the opportunity to meet that fear with actual evidence. And so through this rigorous, careful, thoughtful, long-term process of monitoring what happens to folks, good and bad, over the long term, that's when we'll be able to meet all of these fears and say, no, here's the real picture.
I love that. Thank you. We're going to take a quick break and we will have more right after this. Stay with us. And welcome back. Thanks for joining us today. We are continuing our conversation with Dr. Adi Ray and Heidi Pendergast on Oregon's regulated psilocybin industry. Heidi and Adi, again, thank you so much for being here today. Let's get right back into it. I wanted to talk about some of the data that we saw. It's brand new information we are just getting from the state this year. So at the start of the year, the state actually began tracking all of the psilocybin therapy clients directly from providers. And just this week, they released those first quarter results. So over 1,500 people received therapy in the first quarter of the year. More women than men actually sought treatment. The largest age group was 35 to 49, and nearly half of the clients that answered the survey were from out of state. Heidi, what stood out to you when you saw the data so far this year?
First off, it's super exciting to have this data. It's the first time there's been any state-regulated data on a psychedelic program ever, so the OHA has done an incredible job at implementing this. I've been particularly looking at the safety tab. If you go and look at the data, it's something we track as an organization, and it's really become more nuanced within Senate Bill 303, which has produced this data tracking. And what we're seeing is, again, that the number of adverse reactions are still very, very minimal. There was no reported severe medical reactions to this that required transportation to a hospital. And so again, just proving and really looking at the safety profile of this program is really remarkable, and we'll continue to monitor and track that.
Adi, what about you?
Yeah, so our group has done some qualitative interviews with service center operators and some of the facilitators who work in those centers, and what they're reporting to us is, although we're all super excited to be having data, we do have a lot of room to grow in that they're finding it is a relatively big burden, not just on the clients to fill out all of this information, but it's also a big burden on the centers to report all the information. Now, this is the first quarter. Things are going to change. Systems are going to improve. Next quarter is going to be different. But for the time being, some folks have expressed concern that maybe this data isn't as accurate as it could be because folks are just trying to get through all the paperwork.
Yes, I think we've all been there, actually. We know what that feels like, just rushing it. But it's nice to be able to have the people who did answer, and I think it is exciting, as you mentioned, to see this data. I want to talk about the story we touched on at the beginning of the show. It was a first of two-part series, and in the second part, we actually followed a woman named Danielle. She allowed us to go along with her on her journey. She sought psilocybin therapy after losing her son about 2 years ago and was experiencing very intense grief. We took our cameras with her and followed along as she went to 7 Gates in Portland for her treatment. Here's what she shared after her session.
This experience was probably the most profound gift that I've ever received in my entire life, because it encompassed my entire life.
So I was so moved by her process and watching her heal. I mean, it was something that will stick with me forever. What was interesting also, though, is she was surprised at the intensity and also just of how powerful this was. Heidi, do you hear a lot of stories like this?
Absolutely. And there have been multiple cohorts of veterans through this program, of breast cancer survivors. People are coming because of end-of-life distress or grief. This is an incredibly powerful substance, and it makes a big impact on people. So that's something that we definitely hear, and it's why there's been so much care and thoughtfulness in the setting up of this program.
Adie, one of the things that I wanted to mention that was really interesting is Danielle said an unexpected side effect of her psilocybin treatment was that she got her sense of smell back after she lost most of it from COVID-19 in 2021. Have you heard of this happening for anybody?
This is the first that I'm hearing of this particular kind of phenomenon, but I think what it shows is that's a really easy observable change that we could measure directly, right? Whereas these other more subtle changes in a person's psychology and their subjective experience of the world, those are a little bit more difficult to quantify. So I think what it tells us is this, restoration of this previous function isn't just about our senses, it's about the bigger picture as well.
Are there other areas that psilocybin could help, beyond mental health?
Certainly. I mean, the literature and the clinical trials list that's ongoing is extensive. There's a lot of interest in psychedelics like psilocybin for things like chronic pain. So things that we would consider, neurological disorders or even inflammatory or immune disorders, everything's connected. So, even for folks who are coming in for what they think are mental health symptoms, they might have some of these other things resolved because it's all connected.
Yeah, it's a lot we don't know,
exactly.
As you mentioned before. Yeah. Heidi, what do you hope for the future? What's next for this industry? What do you hope happens here in Oregon and beyond?
Yeah, well, first, I hope more people find out about this and utilize the incredible centers and facilitators in this program that is up and running. We would like to see this folded into the behavioral health system within the state of Oregon and to be made more accessible to people here, and to have the state, again, support this program and help fund services here, because although it can be cost effective, it's also incredibly, incredibly impactful.
Adie, what do you hope we'll start looking at as far as in the research areas for psilocybin?
What we would really like to see is more representation. So if you look at all of the previous history of psilocybin clinical trials, it's a very narrow band of people who have had access to be able to participate in research. Mostly white, mostly male, mostly educated people. And so if we can expand research access, and here we have a beautiful community, program where anyone can participate as long as they're over 21 and they meet all eligibility criteria that the OHA requires. This is an opportunity for you. So as facilitators, there's a wonderful invitation to clients to participate in this research, to make sure, especially people from historically underrepresented backgrounds, they have a chance to have their success stories documented.
So how can people be involved if they want to?
Yeah, if you go to openpsychedelicscience.org, there's a whole bunch of information about the studies we're doing. The recruitment flyers are there that'll tell you exactly what the research involves and how to get involved. So I'd highly encourage anyone who's interested in participating in psilocybin research to go to openpsychedelicscience.org.
And we only have 30 seconds left, but if someone wants to maybe learn more and maybe access this, what do you recommend for them?
Absolutely. We have a client education guide for people who are interested. So go to healingadvocacyfund.org. We have client resources on there. Just click on there and they'll get you started.
Okay, awesome. Heidi, Adi, thank you so much. It's great to have both of you on the show today.
Thank you so much. Appreciate it.
And thank you so much for watching. I do want to mention, if you're interested in seeing part 2 of my series on psilocybin therapy and watching that personal journey by Danielle, you can just head to our website at kgw.com and search for those stories. It really was an incredible transformation, and I'm so happy that I was able to be a part of it. So thanks so much for joining us this week. And a reminder, you can watch Straight Talk on your own schedule. You can download the free KGW Plus app that's available now on Roku, Apple TV, and Fire TV. Thanks for watching. We'll see you back here next week.